class, the anatomy, what that anatomy looks like, the surrounding structures, what's the function of that portion of the anatomy, and what are the most common types of pathologies, then you're gonna be successful in this class. You know, just like, you know, physics, you know, you have a test coming up in the summer, so, you know, that's gonna be the most important thing coming up for you guys in the next few months, studying for that exam. Okay. Somebody have a question? Yes, ma'am.
We won't be doing outlines, right?
I won't require you guys to do outlines. I won't require you guys to do it. Unless Miss Shepherd, that's what she does, but as far as like, I'll ask her to be for sure. I'll ask you, do y'all normally do outlines in your anatomy class?
1 point.
Okay, then you may incorporate that. I have to ask it, but I will have different homework for you guys in general. So, boom. All right, so let's get down to the calendar here. So guys, we have a test next Friday. Next Friday we have a test on chapter 15. So please guys, get ahead of your reading. Hope you guys, I don't know if you guys, have y'all already started reading this chapter? No? Not yet? No? I know it's day one. But definitely get ahead on your reading, okay? Because we're gonna have to know all about this test right here. I mean, know all about this chapter right here by next Friday. So if you can get ahead of that this weekend, because you never know. We may have a quiz in this test on Wednesday. Who knows? Maybe. Possibly. Likely. Alright? So there is approximately, how many tests we have? One test right here, 2, chapter 16 test, chapter 17 test, 3, 4, 5, 6, 7 exams during this semester right here. 7 exams, that's 7 chapters we're going to cover during this semester. Again, chapter tests are worth 70%. So that's essentially like 10 points per exam, pretty much, right? Pretty much, right? So 7 exams during this semester. The way it is lined up, I really think, because Ms. Shepherd made the schedule, the way it's lined up, I really think she gave us a lot of time per chapter to really get this information and really learn it. I was gonna assign you guys presentations to do during this class, but again, I didn't want to put too much on you, but I was gonna do that because you have presentations to do next semester in the summer, right? So I was just trying to give you guys an early little dose of that so you can be more comfortable when you have to present in front of, you know, in the auditorium. Because you're gonna present in Ben Taub Auditorium just like we had the award ceremony on the stage. You're gonna be on the stage presenting your pathology. So, but I brought it down. This semester already has 4 classes. I used to 3 and 3, right? So this semester has 4, so I'm gonna chill. So again, we have what? 5 lectures on chapter 15 and have a test, then we have a holiday, Martin Luther King. I gave you guys a syllabus. I'm not gonna go through every part of it, but if you wanna know what we're doing, keep that, because you know I try to stick to the syllabus. I try to stick to that calendar if we can. I think is there on the last day, did I leave an extra day out? Okay, I have three review days. So in this class, I'm actually gonna probably gonna adopt Ms. Shepherd's routine. I know she lets you guys look at your previous exams before the test, right? In this class, I don't know if I'm gonna do that in physics yet, but in this class we will.
That time
Didn't y'all do that?
Last time we didn't have. We have changed only one time.
Only one day? I mean, it's not gonna be 3 days, you know, if you're looking at old exams, but we're definitely gonna review before you take the final. That could be different elements. That could be Jeopardy. That could be Kahoot. You know, that could be, you know, going through chapter by chapter. Bring questions. You know, I may even incorporate you guys making questions for the test. You know, if it's not a cat in the hat question, you know, what is the gland in the neck? You know, I'm not gonna like that question, but you know, if you have a more complex question, I may incorporate you guys making questions for the exam. All right. So that's the syllabus right there, guys. Right here, I'm gonna pass out. This is actually the NEC requirements for this chapter right here. So this has everything I need to teach you about the thyroid. Okay, we're gonna discuss the thyroid, parathyroid glands, in this chapter. Okay? So as we go along, if you want to check it out, feel free to check it out. You know, because we're going to be covering all of these things. Okay? Don't let it overwhelm you. It looks like a lot, but it's really itemized. So it's not as much as it looks like.
Stays on it.
That's 7 exams, right? So, real quick, before I move on, are there any questions on the syllabus? Any questions on this class in general? What we're going to be doing? Questions?
Break?
Comments?
Do we have break between the lecture?
Huh?
No, I think it's be after the class. Right?
Like from this class to the next class? Do you have a break? Yeah, I'm sure. I think it's the same 10 minutes. Or, yeah, the same 10 minutes. Definitely. Definitely. I think you guys have a 45-minute lunch this semester, right? We'll talk about it. I have it. I'll have it ready for you guys in physics class because I have a whole presentation, a welcome back presentation for you guys for physics class. This class I didn't want to because Patel wanted to join me and talk about clinic in that class, so I was normally going to do it for this class, but she doesn't come in here till later, so I pushed it back to that class because in physics. On the schedule, this class actually is scheduled to start chapter 15 today, which we will. Physics is just an intro syllabus day.
Okay.
All right. So we're gonna, you guys are gonna be, it's cake today. I don't know if you guys are doing an OB, but we have a nice little schedule for this Wednesday that feels like a Monday. All right. So guys, take a look at that. This right here. This is everything we're gonna cover. Or even when you're studying. This is the NEC, so the NEC gives us our guidelines as far as what we need to teach you guys for every single chapter. All right. So as you're studying in the book, make sure you're finding whatever these things are. This list is everything on this list, so you can make sure you know that information. That doesn't mean that that's going to be everything on here is going to be on the test exactly like my exam, but that means as far as like taking your registry. You have to know everything, and I have to teach you everything that's on this list right here, okay?
That's a good idea.
Good. All right. So, feel free to keep this right here, guys. Keep that right there. All right. So, no questions on that? What's so crazy about Harris Health is that I can send a large email file from Harris Health to my personal email. But I can't send a large email file from my personal email to the Harris Health email. The same exact PowerPoint. So, guys, bear with me. I'm probably going to be looking at my phone for some of my lecture notes. Like I said, this lecture, I don't know if you guys, anybody has a laptop up, this lecture is really vague as far as the information compared to the information in the book. Okay? So make sure you guys are reading. And if you have your laptop, make sure you're taking notes on your slides because like I said, those are really vague compared to information embedded in this book. All right. So this class ends at 8:30. Yeah, 8:30.
7 to 8.
I can't believe I'm gonna be talking that long. All right. This is gonna be a funny little layout. I hate having to walk back and forth like this. This is no bueno. I get my flow down. We just found out we were changing rooms like last week? No, like the week before we left. So that's the syllabus, guys. Any questions? I sent you guys everybody have the Jasmine has it, so I know you got that. The lecture. Okay. Start this lecture right here, chapter 15. Again, I'm gonna keep it really superficial today. Like this class, dude. Superficial. I'm gonna keep it really superficial. I'm gonna dive deep on Friday. Okay? I'm gonna dive deep on Friday because and that's my bad for just being trusting that this PowerPoint is gonna be efficient for what I need. Alright? So guys, I'm on page 423. 423 in your book right now. Well, 421. That's where the thyroid starts, part 2 of this book right here. y'all good with the lights on? Remember, we don't have a window in here, so we have the lights off. It's gonna be completely dark in here. I'm trying to get Miss Shepherd see if we can get a dimmer, but can y'all see pretty good? Have y'all noticed we have the HD projector? How much better this projector is? I'm trying to sell the room to you guys. I'm trying to sell it. How much better? Look how crystal, look how clean this, how clear that is. And look, we can even use the screen in here, not the wall. Right?
Yeah, right.
Right, guys? Right, guys?
They said you might have problems with it sometimes, though.
Oh, I had problems yesterday, so I'm hoping that it does what it needs to do, because yesterday it would cut off like this half of my lecture. I don't know what was going on. I had to turn it off and cut it back on like 3 times yesterday. So I'm gonna try to just, beg it to work with me. All right, so chapter 15, guys. The thyroid gland, parathyroid gland, and the neck. So this chapter right here, it is 421 to 454. So that's I wouldn't say it's that long of a chapter to have the 5 days of lecture. So I think we can get this done and feel comfortable knowing this information. Think about superficial parts. I will say, as far as taking the registry, know when the book says this is the most common, this is the most likely, those are important things for you to know, okay? Those are important things for you to know, because I think this small parts is actually 20% of the abdomen exam. I believe it's 20% of the abdomen exam, so it's not a huge chunk, but it's enough that if you don't know it, you can fail it, And then this only helps you become better in the clinic. All right, so our objectives for this class, I kind of said some of them already, but describe the thyroid gland, embryology, surface anatomy, anatomic variants, and the most relational landmarks. So just like with the abdomen, just like when you think of the liver, you have to know all the structures, anterior, posterior, medial, and lateral, or medial and lateral to that liver, right? So we're speaking of what's lateral to the right liver, guys. What is that? What's lateral to that liver? Ribs, right? Just ribs, right? What's lateral to that liver? Yeah, I think we're gonna keep it on.
Keep it on.
The light? Yeah, I think we're gonna keep it on. Turn it off real quick. It's a setup for sleep. It's a setup for sleep. It's a setup for sleep. We're gonna. It's better. If anybody sleeps, lights coming back on. That's a deal.
Yeah, it doesn't hurt your eye when you
We're
got
making a deal
the
right
lights
now.
off.
Deal right now. Anybody sleeps, lights on. What? It looks like all my people in the front went to the back, and all my people in the back came to the front. What's up with that?
To see if it's give it a grade.
I don't know. Maybe the knowledge is gonna flow better in the front. It's gonna radiate from the front to the back. All right. I guess everybody just wanted to change. No more of our 5 rows we have. I don't know. It just looks different. Y'all just kind of flip flop. Good look. All right. So we're gonna discuss the physiology of the thyroid gland to include how each 3 thyroid hormones enables thyroid function. So that's very important. Knowing the 3 different types of hormones associated with thyroid abnormalities. Do you guys know anybody with has had a thyroidectomy or is taking hormone medication for the thyroid?
I saw one patient yesterday got thyroid removed.
Yeah, just recently? They have that
No.
big that were across
No,
their
no,
neck?
no, not recently, but on the ultrasound I saw it.
Okay. Y'all will be able to notice those patients because they always have to come back every 6 months to a year in order, because that's the thing about the thyroid tissue, it can regenerate.
Right.
And especially if you don't get it all, because thyroid tissue can, when it's developing in your body, it can migrate. So as it's developing in your body, I can have thyroid tissue under my tongue. I can have thyroid tissue under like right below my sternum, posteriorly. So if you don't get all of that thyroid tissue, it'll be able to regenerate and it can kind of grow back. Okay. So I know, and you guys will get to know like the most common things with different patients. I would say a lot of thyroid abnormalities actually happen to the Asian community. A lot of times I do thyroid exams